Okay, good morning, everybody. I'm Neil Kelman. I'm the chair of family medicine. And I wanted to, it's a pretty crazy day today. And I think that our speaker today will help ground us again. I was just thinking that we're gonna hear about nature as a prescription, a way of helping our patients maybe differently than many of us have thought of. And it brought to mind a few things. First, how incredibly needy we are for some relief from this incredible overstimulation that we have, both from the pandemic, from our focus on racism, which couldn't have been more blatantly demonstrated than what happened in our capital 2 days ago, when we saw how the police respond to white people compared to what we had seen in previous demonstrations. And then the revolt itself, how completely bizarre it was to see our capital overrun by these maniacs. But then I also clicked on something much more positive, which was the work of Jack Geiger, who unfortunately passed away this past month. Jack was the founder of the Community Health Center movement. And one of his most famous acts was that he would prescribe food for his patients and actually write it out on a prescription pad. And that became part of the legacy of the Community Health Center movement, to look beyond the things that we normally do to help people into a different frame. So it's with that background that it is an incredible pleasure for me to introduce Dr. Nooshin Razani, who's dedicated her career to connecting children to nature. She's the founder and director of the Center for Nature and Health, which is based at the University of California in San Francisco, the Children's Hospital in Oakland. Dr. Razani is a passionate advocate for the healing power of nature, particularly for those who don't have access to green spaces. The Center for Nature and Health is the very first nature-based clinic in the United States that's connected to a major health provider. Since 2014, Dr. Razani's prescribed time outdoors to her pediatric patients and their families as preventive medicine. The results of the first peer-reviewed and published study showed reduced stress in the parents of pediatric patients at a clinic serving low-income families. The randomized clinical trial is the first of its kind, and it compared the effect of supported park outings versus independent park prescriptions, with the goal of learning how to operationalize a park prescription program in a low-income setting. Dr. Razani is an attending physician at UCSF, Oakland's ambulatory department, and assistant clinical scientist at the Children's Hospital in Oakland Research Institute. She attended medical school at UCSF, completed a pediatric residency at the Children's Hospital in Oakland, and has a master's in public health from Harvard School of Public Health. We're so much looking forward to her presentation. We need this today, Dr. Razani. Thank you so much.
Thank you so much for having me. It's such an honor, and really I feel humbled by being in the presence of each of you and the fact that you're serving the community at this time. My presentation gets a little bit technical and scientific, but it's really actually not very complicated. Nature is good for you, and it's a relationship that each of us deserves to have, and it will help heal you. But that being said, I have worked very hard to help create an evidence base around why and how nature is good for us. And I will go through that today. Oops. I don't have any financial disclosures. And today I hope first to talk through the evidence-based associations between nature and public health, to discuss the ways in which access to nature is a social determinant of health and related to health equity. And then I'll talk about some clinical applications of nature and time in nature, and specifically what you referred to, the work that we did in our clinic and the study that we did recently. And then I'll close by telling you some of the new work that I'm doing now post-pandemic. So people have known that nature is good for us for a very long time. It's part of most cultures. And actually, psychologists have even have a journal of eco-psychology and have known about this phenomenon for a while. But the medical profession really woke up to it after a study was published in Science, where a landscape architect who himself had had many medical problems worked with surgeons to look at the recovery time of patients who had had gallbladder surgery. And it just so happened that in the hospital where they worked, there was a recovery room that looked out on a brick wall and a recovery room that looked out on a scene of nature. And they looked backwards at about 23 patients in each arm. And what they noticed was that patients who had the view of nature had fewer days in the hospital post-op. And nowadays we know that no one stays in the hospital 7 days post-op, but back then people did. They had fewer negative comments, or they made fewer negative comments towards nursing staff, and they had less analgesic use. And so this really important paper started the idea that there's something restorative about viewing or being around nature. So since that time, which was in the 80s, and that was one study, there has been a renaissance of research on this topic. And if you look, even this little graph down here is a PubMed search. And if you look at results by year, even since 2005, when I started this work, to now, the number of studies coming out has grown exponentially. And really, we have evidence that nature is associated with health across the lifespan. And there's outcomes that range from prenatal outcomes all the way to outcomes in the elderly. And I'll go through some of the most important papers, I think, in this presentation. There's also evidence for health benefits, not just on an individual level, but for families, communities, and secondary benefits to economies, and of course, to nature itself, which is an area of interest for me. I think a lot of the physicians that are interested in this topic actually care not only about people's health, but also the health of the planet, and have the belief, which is evidence-based. I'm not going to talk about it now, but a relationship with nature, experiences in nature in childhood, and a love for nature is correlated with environmental stewardship and actually caring for the environment later. And I'm happy to talk to you about studies about that if anybody would like in the question and answer period. So the evidence about nature and health really falls into three big categories. The first are these really big population level studies, a lot of them coming out of Europe, looking at the impact of different levels of residential green space on a variety of health outcomes. Then there are these pre and post studies looking at the immediate health outcomes of putting usually an urban person in a natural setting. And then there are fewer, but some really convincing interventional or quasi-experimental studies. And some of the most important ones that came out were first a study that came out in Lancet in 2008. And there have since been many that are like this, which showed basically that, and it looked at the entire census and showed that those who live in greener neighborhoods have reduced mortality at every income level. In terms of experimental studies, this one by Gregory Bratman in 2015 made the argument that walking through nature helped with depression. And this was done in the Stanford area. He took 38 healthy participants and randomly assigned them to either walking in a natural environment or an urban environment, and did questionnaires and scanning procedures and showed significant improvements on depression scales. This was a very small study, but one of the very first that was a blinded controlled study, and it took 17 kids with ADHD, most of them boys, and randomized them to one of three walks. One was through 20-minute walks. One was through a park, one was through a busy neighborhood, a more suburban area, and one was through a downtown area. And what they showed was that measures of concentration improved after the walk through the park. And interestingly, measures of impulse control did not improve, but concentration seemed to improve. And in this article, they actually made the argument that the improvement was equivalent to taking methylphenidate, which I don't, that's a big topic we can talk about, but it was a pretty well done study that was important when it came out. And then this is one of my favorite, this is some of the best work that has happened. And this happened in Philadelphia by Dr. South. And what they did was look at all the empty lots throughout the region and randomly do one of three interventions to the lots. One was greening, one was just cleaning up trash without greening the empty lot, and then the third was no intervention. Then they surveyed the surrounding neighborhoods without telling them what the study was about, and so they were blinded. And what they found was, and I'm sorry, they did pre and post surveys with the surrounding neighborhood. And what they found was those, the people that lived near the lots which had received the greening had a significant decrease in feeling depressed and feeling worthless, whereas there was not that change in the other two arms. So all this body of work has now resulted in creating what is talked about as like the mechanism of action of nature. And at the beginning of the talk, I said that I'm going to make it complicated, but it's actually not that complicated, because it is a little bit funny to try to reduce something as grand as nature into the biomedical model, which sometimes I think talking about nature is almost like talking about maternal love. Like, you don't really need to quantify how much love you need, you just need love. But it helps anyway. So to the extent that this helps us encourage patient behavior, the four main areas of evidence are around nature and air quality, nature and physical activity, social contact, and stress relief. And I'm going to go through each of these four pathways. So I think the most robust area of literature is really around nature and stress relief. And I mentioned that there are a lot of pre-post studies, and quite a few of these are in the area of stress relief. For example, studies like one showing that a 15-minute walk through a forest compared to the same walk in the city results in decreased levels of salivary cortisol, pulse rate, blood pressure, and improves hormone ratios. And then very large studies showing that there's lower anxiety and some other outcomes that are also thought to be mediated by stress relief, improved outcomes. Nature and physical activity, I think, has less convincing. There are studies that show that living around nature improves physical activity, and there are some that don't. And definitely making a change in BMI is a lot harder, and the evidence on that is mixed. But it is significant that for every hour that you're outdoors, not just whether you're in nature or not, children in particular seem to be more physically active. And in this study by Cleland, which was actually a prospective study, the kids that spent more time outdoors ended up having less overweight over time and were more physically active in the Cooper work. There is actually a systematic review looking at exercise indoors and then that same exercise outdoors in a natural environment, looking at studies that compared those. And it seems that there is an added value to doing exercise in a green setting. And it seems to be really an emotional benefit. And how do I put developmental milestones encouraged outdoors? That is true, but it's not necessarily part of the systematic review. The systematic review also looked at things like cortisol and blood pressure and other outcomes, and this was done in 2010, so there wasn't as much literature at that time, but those things were not significant when you looked across all the studies. But the negative emotions seemed consistent across all the studies. The nature and air quality work is really, really interesting. And a lot of the work on birth weight and maternal health outcomes seem to be mediated by air pollution and the fact that living around green areas improves air pollution. By the way, the photos in my presentation are from our nature program at Children's Hospital Oakland, which I'll talk about. And then being in nature somehow seems to improve the way human beings connect with each other and the human connection. And that's both in families and peer groups. And as I'm sure you know, relationships are protective, and social integration has a dose-dependent protective effect on health. And this picture is of a series of outings that I organized within my own community group outside of the hospital. And I think it's what I used to think of as nature outings, which would be these big group events. But post-coronavirus, we've really had to pivot to family-based events. And I just want to remind all of us that that's okay, because even for pediatrics, even a single relationship, especially one between a parent and a child, is extremely powerful. And I believe that nature is one of the best landscapes to help develop that, that relationship. Usually childhood development is not included in these big pathways, but for those of us in pediatrics, exposure to nature and the opportunity for unstructured free time in nature is really key to supporting childhood development. And just the time to play outdoors gives kids time to develop executive function, to develop social skills, and to relax and have fun. And it also allows for opportunities to have attachments, not just within your family, but with people that you may see outdoors, and to have social connections in neighborhoods. And I would argue also for the opportunity to have attachments to animals and to place. And it turns out that place attachment is actually a developmental milestone that happens around age 5. This picture on the right is a little sanctuary that my daughter made for a sick butterfly. And I usually include it just to remind us all that for children, nature doesn't really have to be big in order to be a rich landscape for play. And actually for kids, what they are looking for are small manipulatable pieces, as opposed to what adults want from landscape, which is beauty. Kids really want things that they can build and create with. And it's often like the leaves and the branches that we clear out of spaces, which is what kids want from spaces. So the final area of research that I think is really important is the research looking at the fact that nature can actually be used as a tool to really address some long-standing inequities in communities. And again, in a whole census study in England, they looked at people who were younger than 65 years old. And this is a really busy slide, but basically they split the whole population into 5 levels of income. And they also split them into, 3 levels of income, but 5 levels of exposure to green space. And what they found is that there was an increased risk of all-cause mortality in the least green environment. There's also an increased risk of mortality in the lowest income environment. But when you look at cardiovascular disease, for example, in the lowest green environment, the risk is higher than those who are in the most green environment. I hope I said that right. I'm sorry, I said it wrong. Basically, when you are in the lowest income group, the risk of cardiovascular disease is reduced by having exposure to green space. And so essentially the thought is that green space buffers the negative impact of poverty on cardiovascular disease. And interestingly, there was no difference in lung disease or intentional self-harm. And this article argued that cardiovascular disease is a reflection of stress. And that's why exposure to nature would buffer its impact. So this is a big survey that we did of children's health, but in the interest of time, I'm going to skip it. So this is, all of this research was coming out when I was working at an FQHC in Oakland. And the challenge was really to take this evidence that nature is good for you and really talk about it with patients in the context of the fact that, like, great, but there's no nature where patients live. And in fact, like in Oakland, if you look at this graph here is a map of life expectancy at birth. And in Oakland, like in many areas, a mild difference in zip code can result in 10 years of difference in life expectancy. And if you put zip code and race together, that's a 14-year discrepancy. And then I often overlay these maps, but I haven't here. But if you look at this top right map, which is a map of green space that the Trust for Public Land has available for every city across the country, not every city, but many, and I'm sure they have New York, you notice that the areas with less green space also happen to be the areas with lower life expectancy. And finally, in Los Angeles, they did this association study in a very rigorous way. They just announced the results last month, correlating life expectancy in the United States with green space. And then for my patients, if you look at the third map, which is basically the map of toxins and environmental injustice, it's the very same, basically the same map, which shows that the hills are where you have nature and the flatlands are where you don't have nature. Actually, the flatlands have less than 5% of the tree cover in Oakland. They're also where there's less life expectancy, and they're also old, toxic waste sites where you have higher levels of cancer and heart disease. And so in this context, like, how do you just write a nature prescription to tell people to go outside? And actually that pattern, if you look across the United States, you will note that access to nature is actually a marker of privilege. And it's interesting that there are some studies that show that nature contact in particular, not parks. Parks is very different than nature, but contact to nature is correlated more closely with race and ethnicity than income. And so some of that is a consequence of redlining and racial segregation in the United States. But this was a very interesting look at satellite data, which is NDVI, showing greenness. And for some reason in this chart, the green color represents white race. But if you notice that neighborhood compositions with more white race have more green. I guess that's why also. And then the second figure shows delta over time. And what they showed was that those neighborhoods with higher people of color basically lost more green over time, over a period of 10 years. So in around 2012, we were approached by East Bay Regional Parks. I was involved in some park prescription work elsewhere, but we were approached by our local park district to work together on a park prescription program. And basically the clinicians and myself pushed back for all the reasons that I just mentioned. And we basically said, like, it's not because of a lack of a piece of paper from us that people are not in nature. But the amazing thing is that our park district just didn't go away, and they kept asking us, well, what would make it better and what can we do? And so we developed what we call a park prescription, but it's actually a relationship between these two institutions to try to surmount barriers to time outdoors, improve parental stress, and promote childhood resilience. And there was a lot of pressure on us to make our program about obesity, but we really looked at the evidence on nature and saw that a lot of it had to do with stress relief. And we hope that it will impact weight over time, but we chose stress as our main outcome. The first thing that the clinicians I work with said is, well, you need to bring nature to us. And so short of planting trees in neighborhoods, which we have applied for grants to do, we haven't gotten them yet, but we also, the park district decorated our clinical space with big posters of nature, and every room and every pod is named after a local park. And we have amazing parks, which many of our patients don't go to, but in addition to neighborhood parks, we have regional parks, which are really wilderness sites. And at the bottom of each big poster in the clinical rooms is a little map with how patients can get there. And I've been in session with patients where they're like, is that where I live? And you say, yes, that's your park, it belongs to you, and that's how you get there. Getting buses to go to parks is a different battle, but we've tried to work on that as well. Our prescription was basically for, we said it was stress, but it really has ended up being for anybody who wants it, because everybody's nature deprived at this point. We did make these actual prescriptions, which I'm happy to share. And we also had a journal, which we used for the trial. But the truth is, it's really hard to have extra materials in clinic. And so the best thing that happened to us was that we now have we have a question integrated into EMR, which says, do you have access to outdoor spaces for play? If the answer is no, then they get an immediate referral to our program, but people can still be referred to our program without answering no on that question. So in terms of what happens if someone gets a referral to our program, we did the trial, which I'll talk about, but for the past 6 years, we also have actual monthly nature outings. And so after we asked the parks to decorate our clinics, we said, well, you need to give us transportation, you need to give us food, and you need to give us programming. And the reason we asked for transportation, I think, is clear. The reason we asked for food is because there is research showing that food and being in community while eating is something that really resonates across nature as an activity across cultures as an activity to do in nature. And picnics and barbecues are a way that many of us gather outdoors, and resonates better than talking about hikes, even though we may go on hikes, but we talk about being together in community outdoors. And then the programming we felt was important because really the presence of a naturalist with us gave a lot of legitimacy to the program, and it's actually become a very big part of why people come, is because the relationship they've developed with the naturalists. And so everything we do is to try to make people know that they're welcome in nature and that however they experience nature is okay. And then in terms of being developmentally appropriate, I personally am basically the protector of what I call the nothing, which is the unstructured time. And I've learned how, I've learned the words that, like, oh, well, nature, you need time to have awe, or you need to have a nature connection that is unscripted. And I found ways to talk about it, basically to make sure that no one tells the kids what to do and they can just be free. And these are some photos. One other thing that we decided to do, which you will understand as family practitioners, is we did not want a program just for children. We wanted this to be family-based, and it's often actually multi-generational based. And so when a child gets a prescription to come on the outings, they can invite their family, and sometimes that's one person, and sometimes one time it was 17 people. But this being in nature is a family activity that we hope people will continue without us. And so the family is a really big part of that. And then these pictures, this is my son and a patient that's been coming for years. And the Park District has been very generous in helping us make the outings accessible, both by providing a separate bus for kids in wheelchairs, and then they have a special beach wheelchair, which is awesome. And then on the right-hand side is one of our residents, Morgan Green, who took Shine. The name of the program is Shine, if I didn't mention that, Stay Healthy in Nature Every Day. He really took it on and helped us expand the program to include residents. So I just will make sure that I have time. Yes, okay, so we did, towards the beginning, conduct a randomized trial by looking at 78 parent-child dyads. And as was mentioned in the beginning, we randomized them either to a group that received that whole big thing that I just said, the ride, the food, the group outings, and the unstructured time in nature. And they actually were invited to that 3 weeks in a row. So for the time of the trial, we had weekly outings. And then the second arm of the study, parents just received a map and in that journal that I showed, and a discussion with a pediatrician on why it's good to be out in nature. And so what we saw is that amongst parents in both arms, weekly park visits increased, perceived stress decreased, loneliness decreased, and physical activity per week decreased, and cortisol level decreased, and that each unit improvement in these things was associated with each increasing weekly park visits. What was very interesting is that actually the group that ended up going to parks more was the group that did not go with us, basically the independent park prescription group. And these two, we over-enrolled in the supported park prescription group because we know that a lot of people wouldn't show up to those outings. But if you look, the number of park visits in the last week increased more in the group that went on their own than in the group that actually came with us, which actually went down a little. And what we think about that is, well, either our outings were not fun, or that actually one of the amazing things about a park is that it is where you live and you can go on your own time, and that maybe we were being a little bit patriarchal or thinking that patients needed or wanted to always go with us. The other thing is, I think that we really, the group that came with us ended up having these big, great once a week experiences. And so they may have kind of learned to go once a week in a bigger way, as opposed to smaller visits more than once a week. It also ended up that the group that was in the supportive prescription arm had a lot more barriers to getting outdoors. But that was one thing of interest. And then in children, we looked at a set of outcomes, but our primary outcome was resilience. And we measured resilience using a brief resiliency scale. And what we showed was that every increase in weekly park visits improved resilience, and that was mediated through stress relief. It was interesting that whether or not people listened to the park prescription was related to their baseline nature affinity, knowing where to find parks, how they rated them if they had money, and time to visit parks. And even though our income was mostly low, our sample was almost all people of low income. It's important to note that, and also people of color, but income, race, and gender were held stable when we looked at this. And it is important to me to tell people that race and income did not influence who ended up using a park prescription, because I like to make the distinction that just because people of color may have less access to nature doesn't mean that there's less of a desire or connection with nature. And that there is a misconception, I think, in many conservation circles that people of color need to, quote unquote, be connected to nature. And that's not my experience. Actually, my experience is the opposite, that there is already an existing connection with nature that runs across all ethnicities. And it's not really one group's job to connect the others. We are all basically disconnected at this point. Lessons learned in partnership with the parks, really over time. It's been a journey many park districts do not have longitudinal relationships with the people they work with. They have one-time programming and they rotate staff. And so we now have the same naturalist, which is Morgan, this woman, amazing woman. And really, some of the families really think of her as part of their family, and we see her as part of the medical team. We've also really worked hard to develop a joint vision. We've worked hard to create consistent, reliable programming that happens at the same time every month. And that's really helped us gain traction in our community. And then we've really been working on our understanding the ways in which both the hospital and parks replicate some of the isms found in nature, in our broader society, and to really work on making sure that our outings are not adding to trauma for patients. So I give this presentation with a little bit of grief because we have had to pivot post-COVID. And we have had only one in-person outing since March. Since March, we've been doing online outings. I think personally that online nature is a little bit lame, but it's an amazing way for us to maintain our relationship with the parks and to be present for these families that we now have had a relationship with for 6 years. And so once a month, we do really fun things online. And we spent the extra money that we had from programming on hiring local artists to sing and read to patients during our outings. And Morgan takes us, and now she can explore many more parks that we used to not go to. We've developed a protocol for when we will be in person, and basically we'll be in person when COVID is in the red or yellow tiers. We also have wildfires to deal with. So We also have a protocol for whether we can be outdoors based on wildfires. And then when we are outdoors in family pods. And the first time we did it, people had to drive themselves, which was very hard. But the next time we do it, the park district will be providing Lyft vouchers for folks to come as family units. And then we gave them like a big backpack with a scavenger hunt, which they can do on their own. And at the end of the scavenger hunt, Morgan is standing distant from everyone and did a little demonstration. It happened to be about sharks because we were at the bay that day. So I think that's all my formal presentation. These are things that I'm involved in now. I'm working on creating a nature network of care for, California is now providing a very small amount of compensation to clinicians for screening for ACEs. And so we are helping build capacity among park districts and what we call nature providers to receive patients who screen for ACEs, screen positive. And then I just wrote a systematic review on outdoor transmission of COVID because I'm trying to make the argument that we should be allowed outdoors, especially school districts. And then we're doing a qualitative study on the importance of nature connection during a pandemic. And I'm happy to speak to any of those if there's interest. Oh, and then this is really important. So I talked about how many of us who are doing this work actually care about nature. In September, Anthony Fauci wrote an article about emerging pandemic diseases and talked about the importance of our relationship with nature for preventing future pandemics. And it was just really amazing to hear him say this, but he wrote that there are many examples where disease emergences reflect our increasing inability to live in harmony with nature. And living in greater harmony with nature will require changes in human behavior, as well as other radical changes that may take decades to achieve. And so potentially clinicians talking to patients about connecting to nature is important for their own health, but also for preventing future infectious diseases and planetary health. So thank you for your time.
Thank you, Dr. Razani. We have a question in the chat from Dr. Crump. I'm going to read it out. You mentioned briefly that parks and nature are different. Can you say more about this and how the research evidence for health effects might compare between park or nature exposure?
Yeah, so I mean, I kind of think about this whole area of research in three separate regions. One is just being outside at all. And there's a whole body of literature about that because especially now during the pandemic, but even before, there's evidence that children in the United States don't spend even 1 hour out of doors, which is just really not acceptable. So one is there is literature on just health improvements on being out of doors compared to indoors. And a lot of that has to do with the physical activity that I mentioned. Then there is quite a bit of work on parks and park exposure. And parks are very important. They are spaces for communities to gather, and they have many benefits. And whether or not they have nature is not, always something, it's not a one-to-one correlation. They often are green spaces. They are not always green spaces. And it happens that what I've seen is that some studies show that low-income families and families of color actually have more park exposure than other families, but they don't necessarily have more nature exposure because the parks do not always have green elements in them. And then the third bucket is nature, and nature is I mean, it's a very tricky thing to define. It is actually, in some ways, it's a social construct because, I mean, we are nature. Basically, you could think of nature as everything. The way it's often studied is green space, which is exposure to trees and vegetation. There are also people that study blue space, which is exposure to water and waterways. There are people that study yellow space, which is sand. And then there are really others who used to be in the conservation field, but are now, these lines are all blurring, but who define nature as biodiversity. And the goal is healthy ecosystems, which is often the most biodiverse ecosystems. And so the people who look at nature in that way, for example, there's a lot of work looking at the human microbiome, and that when we are in natural settings that are more biodiverse, our microbiome is also more diverse, which is healthier for us. So that's a little bit on that.
Thank you.
Well, and then in terms, I'm sorry, that in terms of the park and nature work, I do know that a lot of park agencies are asking for more research that's specific to the fact that outdoor green space is good in parks, because there is a lot of work showing that a rec center, trails, equipment, that these things encourage physical activity. And so they often have an easier time advocating for funds for structures within their parks. And they have a less easy time advocating for just nature, basically. And then there are, I didn't also mention that there is a whole green schoolyard movement that is looking at schools as parks and schools as area of nature exposure, which is also really wonderful area of work.
Thank you. I do have 2 questions in the chat from Suzanne Callahan from our upstate site. So do you want me to read them both at the same time or go one at a time? Probably one at a time. So the first question, can you say more about not recreating trauma in your nature programming? You had alluded to this in your presentation.
Yeah, I mean, I think that trauma in the race-based trauma has always occurred in the outdoors in America's history. As an example, during segregation, swimming pools were not available to the Black community. And so part of that legacy is a much higher rate of drowning in Black children, and actually in Indigenous children and also Latino children, although the rates are highest in the Black community. So, you know, that's some of the historical legacy that we have, not even speaking even, of course, during slavery. But if you move more recently, I mean, just we, in the last year, have seen images of people hanging from trees. I mean, that's extremely traumatic. People being basically executed for running outdoors. And so these are some of the stark images of trauma in the outdoors that we've all been feeling, you know, in different ways, depending on what community we're in over, I want to say the last year, but it's actually historical. But then there are also, you know, as an example, on our outings, we often, the naturalists are white, and that's a, you know, that's a discussion that we have with park systems in general, which are working, you know, hard. Maybe they could work harder, but they are working to start employing them, you know, the communities that they serve. But the environmental movement in general is a white movement. it is hopefully transforming, and I believe there's a civil rights movement happening within the environmental movement for now. But you know, and we have all kinds of interactions during our outings that we just really need to debrief about. And then the medical system has all kinds of trauma associated with it. And so there's so much that happens that's dehumanizing in our patient interactions to ourselves and our patients, but we just want to make sure that that is not replicated in outdoors. And so Morgan, the resident that I spoke about, his name is also Morgan, and our naturalist's name was Morgan, so it's a little confusing. But Morgan spoke about the fact that on the nature outings, it was some of the few interactions that he had with patients where they were not in a space of fear, and they were not like worried about the health of their child. And so it really transformed the way he saw parents. Instead of thinking of them as in a deficit model, all the things, negative things that they were facing, he saw them in times of happiness and joy. And he just, like, the amount of like strength and capacity to deal with life that, as you know, the caregivers that we serve have is tremendous. And sometimes our training doesn't really allow us to see that, but it comes out more during the nature outings. But we have to be careful the ways in which we're conditioned to talk to patients as if we know how to live, and they don't. And so we have to be really mindful about that on the outings. And the providers, we often bring our kids, and it's very humbling the ways in which we realize we're actually like way behind compared to the families we serve in terms of like multitasking, being with our kids and at work at the same time. I don't know if that answered the question, but it kind of speaks to some of the dynamics.
Definitely. The second part of this question is, can you say more about how you trained clinical providers to provide prescriptions for families to engage in nature? And was there a resistance to embracing this? You did allude to that a little, that you even resisted starting this programming when the Parks Department reached out to you initially.
I mean, I think the idea of a nature prescription was a little bit just annoying. I think now, like the food is medicine movement has helped, but really it's just more and more of asking the primary care clinician to deal with things that are really, systemic issues. And so I think part of the pushback was, you need to create more parks in the neighborhoods where our patients live, not ask us to give a park prescription. But that really wasn't resistance. It was more just dialogue and anger at the world. I think the biggest issue we have is just staff turnover, and that there's a lot of programming. I'm really lucky because the parks decorated the clinic, so this program gets like a big nature thing in each room, and nature kind of speaks for itself, and so everyone remembers. I think the single most important thing is having a question in the EMR, because then you just never have to talk about it and it's just there. And so I haven't actually done many trainings. I do about one noon conference a year about it.
A similar question from an anonymous attendee saying, that was an amazing talk. Thank you for this important work. I've found sometimes interventions like this can be underplayed and looked at as soft medical interventions. Have you found skepticism from the bigger medical community? And if so, how do you deal with that?
I think that's such an interesting question, because through this process, I got my faculty appointment at UCSF, and during my job talk, I was so worried. I was so technical. And then in the question and answer period, like these are the types of questions that I got. Well, how can you talk about nature when we are nature? You know, how can this heal our hearts? Like, I mean, I just think that everyone in medicine is feeling hurt, and they didn't need, like, nobody needs that. And I was so worried about walking that line for so long, but I just, somehow between 2010 to now, the world shifted, and I think we all realized that, so what if it's soft? Like, honestly, I do need to be rigorous in data collection, but it turns out soft actually improves health outcomes. So that hasn't really been a problem, because it actually makes families healthier. I'm just at a point where I'm done worrying about that, but it is a problem for our whole profession. I don't actually know if it's a problem anymore. Those who have more experience than me should speak up to that, but it seems like we don't have time to worry about that anymore.
I love that answer. I have another question here from Dr. Eugene Schiff. What is the relationship between big tech companies, often based in the Bay Area as well, but with global influence like Apple, Facebook, Netflix, Amazon, Disney, etc., in terms of competing for unstructured time away from screens versus in nature for both children and adults, and also the push for and against remote learning for schools this past year in particular? This is a big question, so let me know.
No, I mean, well, there's this really great article, which I can send out to you, that was published, I think it was 2010, that looked at national park visitation and showed that with the advent of VHS machines, the video machines, that went down. And then again, with the advent of iPhones, it went down again. And then now I don't even know. Oh, actually, someone should look at that, because post-pandemic it may be back up. Who knows? But there is evidence that in-home entertainment, in particular, has decreased outdoor time and time in nature. In terms of the role of the companies, I don't have expertise on that. In terms of the role of companies in the school closure issue, I don't have anything to say about that, except that I do, not related to that question, but I do think that outdoors is part of the puzzle, because outdoor schooling is a way to get back to school with reduced transmission risk.
Thank you. And I think we have time for one more question from Dr. Kalman.
Yeah. Well, first of all, this is fabulous work, and soft or hard. I think your combination of the two was amazing. I just wanted to share my one experience. I have 5 sons, and took all of them as a Cub Scout and Boy Scout leader through the outdoors. And one of the things that was so amazing to me was how scouting had attracted so many people with either intellectual or some physical disabilities, or sometimes both. And this sense of competence that people can develop outdoors when they've struggled through a lot of the normal things, like, kids with physical disabilities, couldn't be really on sporting teams, and kids with intellectual disabilities were always struggling in school. And you would bring them to the outdoors, and everybody could scramble over a rock, or, learn to light a fire, or do all of the things that were out there. And I'm just wondering if, maybe that sense of kind of normalization of capability that the outdoors sort of brings to people, as even if they just learn their way around the paths of a park, wouldn't be maybe one of the mechanisms that might be responsible for reducing people's stress. Because so many other things that they do, especially that kids are asked to do, are causes of stress, especially if you're not, completely able-bodied or able-minded.
Oh, that's such a great point. UC Davis has a preschool lab, like preschool learning center, and they did this great work where they greened a preschool yard and they looked at the changes in the social structure of the children. And what they showed is that before the schoolyard greening, the physically dominant children were the leaders of the group. And then after the greening, actually they did 2 stages of greening. One was just to make it green. And then the second stage had like small enclosed little areas where kids could gather. And after that third stage with the small areas, the physically dominant kids still had leadership roles. That didn't go away. But they also found new leadership roles for the more linguistically able and imaginative kids. And so they found new social pods that were developing around things other than just physical capacity. And so I think it really does give time and space for a diversity of types of human beings. And this is also some of the, I think I talked about the heterogeneity in the physical activity literature, is because sometimes when you green an area for children, there's actually less physical activity, because concrete is where wheels and balls can happen. But what they find is when you green a schoolyard, for example, the physical activity may be less vigorous on the green, but more types of children are physically active. Yeah. So I think what the argument is, you just need a diversity of landscape for children.
Well, thank you. We're just getting a number of comments at how terrific this was and how much people appreciated your talk.
Oh,
So thank you for getting up at whatever ungodly hour you got up this morning on the West Coast to be with us. And I hope we can stay in contact, because this is just, it's great work. And I think has been inspiring at a time when we all really needed some inspiration.
Oh, thank you. And I'm just seeing the chat now. I'm sorry if I missed anything. I'm happy to answer it in a written form later, if that would be of help.
Thank you so much.
Thank you. Bye. Thank you.